multi-state outbreak of Salmonella Tennessee infections linked to peanut butter. So, Salmonella enterica, a common food contaminant, is the largest cause for foodborne bacterial illnesses in America. From August 2006 to February 2007, this contaminant made its way into peanut butter. The contaminant strain was discovered from a urine sample of an epidemiology-linked patient in the peanut butter outbreak. The contamination was caused by just one plant located in Peanut Corporation of America in Blakely, Georgia, and the symptoms have showed that there are abdominal cramps in 65%, diarrhea in 72%, fever in 43%, dysuria in 45%. The median age of patients was 52 years, with 73% being female, and 20% of patients ended up being hospitalized with no deaths. So when making the solution for this situation, 3 factors were considered, which is economic factors, social factors, cultural factors. In economic factors, the outbreak potentially can negatively lead to financial impact on the peanut industry, large profit losses. Lower-income families also rely more on peanut butter, which urges the peanut butter plant to highlight the importance of restoring consumer confidence quickly to protect industry revenue. For social factors, the media's role in shaping public perception of food safety crises, including the tendency to quote environmental health activists more than food scientists, like reporters with little science training, which means the public will have little to no accurate information regarding the outbreak. For cultural factors, industry culture of accurate media avoidance contributes to lack of public visibility during crises. Instead, public and media expectations around food and safety and science use communication to reflect cultural attitudes towards health, risk, and authority. So the strengths was that they were able to conduct annual mock drills and audits, which improved readiness and message consistency during real crises. The organization followed structured guidance by conducting audits, forming teams, and identifying stakeholders and maintaining adaptable plans. Also, the Peanut Board and Agriculture Agency updated websites daily, granted interviews, and answered all media requests, which increased transparency and trust. But for weaknesses, few reporters have scientific training, and many food scientists lack skills in explaining technical information in plain language. Also, agricultural organizations had avoided direct engagement with the media, which limited visibility during the outbreaks. For opportunities, this allowed opportunities to train scientists and agriculture communicators to share food safety information in simple, accurate terms for the public and journalists. Also, this allowed them to use digital platforms, social media, and real-time updates to show accountability, building public confidence during and after outbreaks. For threats, sensational or inaccurate media coverage can damage reputation and cause unnecessary panic. Outbreaks can cause skepticism toward food producers even after safety improvements. And during economic hardship, people rely more on affordable foods like peanut butter, so any safety scare can really have a large public health and economic impact. The root cause of the 2006 and 2007 Salmonella enterica stereotype Tennessee outbreak in peanut butter was a post-processing contamination with the PCA production facility. This was caused by moisture intrusion. The moisture came from a roof that leaked during the rainstorm and a faulty sprinkler system that went off twice. These conditions allowed Salmonella to survive and contaminate finished products after roasting. 2 alternative solutions were analyzed based on the social ecological model. Solution 1 is on an organizational level, which is to establish a vice president of global food safety, because this changes internal structure and accountability, and it improves management oversight and safety culture. Solution 2 is on the community institutional level, which forms a food safety advisory committee with experts like Michael Doyle, because this builds partnerships between industry and academic experts, enhancing credibility and evidence-based policy. The third solution is on the policy level, which is to approve a plan to install new machinery and safety systems, because this implements structural and technological controls to prevent contamination at the source. So the first recommendation is strengthen the organizational and policy level food safety infrastructure. Based on the social ecological model, organizations that institutionalize food safety accountability at multiple levels within the production system. This includes maintaining a dedicated vice president of global food safety and food safety advisory committee to ensure that scientific expertise and oversight are embedded in daily operations. Companies should continue to modernize facilities and equipment to prevent environmental contamination, particularly moisture control and post-roasting contamination. For recommendation 2, it is to develop a transparent, science-based crisis communication framework. So, building on the weakness and opportunities identified in SWOT analysis, food industry should invest in training programs that bridge the communication gap between scientists, media, and the public. Public relations teams must collaborate with health agencies and media partners to develop clear, accessible messaging before a crisis occurs. Annual mark crisis developed drills and media literacy training for food safety professionals can improve message clarity, consistency, and speed. Transparent communication, such as the daily website updates and stakeholder briefings, helps preserve consumer trust and minimize economic damage during recalls. This recommendation addresses the communication, the community, and interpersonal levels of the SEM by improving collaboration and public engagement. So, key activities for an action plan for one alternative solution is the main action plan is done by implement regular environmental monitoring and microbial testing. The purpose is to continuously verify that its facility and equipment remain free from salmonella or other pathogens. First is develop a sampling plan. This is where we decide which types of samples will provide the most useful information, including examples include surface swabs, air samples, and finished product samples, and establish the frequency of sampling at each CCP based on risk assessment and regulatory guidance. Second is weekly sampling and laboratory testing, and this is done by collecting samples from all identified CCPs weekly and send samples to certified laboratories capable of detecting salmonella, SVP, and other relevant pathogens. Third is record and analyze data, which is done by maintaining a comprehensive database of all sampling results and including date, location, type of sample, and lab findings. We will regularly analyze data to identify patterns or early warning signs of contamination. Fourth is corrective actions, and so it is done by if salmonella or other harmful bacteria are detected, immediately stop production in affected areas and will sanitize equipment, surfaces, and storage areas, reassess and revise current protocols to prevent reoccurrence. Fifth is continuous improvement. So we will provide ongoing training to staff by updated protocols and food safety best practices to ensure consistency, compliance, and awareness. In addition, we'll convene the Food Safety Advisory Committee quarterly to review monitoring results and discuss potential improvements. We will revise sampling plans, cleaning schedules, and SOPs based on lessons learned, emerging risk, and technological advancements. So parties in this action plan is the quality assurance team, who will execute sampling, maintain records, analyze data, implement corrective actions, and coordinate with laboratories and management. And the second party is Food Safety Advisory Committee, who will oversee quarterly reviews and guide continuous improvements and initiatives. Weekly sampling will be done ongoing every week, and data analysis and reporting will be done weekly. We'll have weekly review of sampling results and quarterly comprehensive review with advisory committee. Corrective actions will be done immediately as needed. So we'll be comparing our case to the Germany E. coli incident, which was in 2011, where there was contaminated imported seeds due to poor traceability and lack of decontamination. So in these two cases, we can see that both outbreaks highlighted need for rapid communication and system-level interventions. Both required collaboration between public health agencies and private industry to control the outbreak. Regulatory improvements were implemented post-crisis to prevent future contamination. The differences was that the U.S. peanut butter solution focused heavily on organizational restructuring and proactive communication, reflecting a manufacturing and low moisture food context, while Germany's solution relied on public warnings, recall of fresh produce, and reflecting the perishability and traceability challenges of sprouts and raw seeds. The lessons learned across the cases was that both situations proved that communication is critical and that policy and organizational changes prevents recurrence. In my opinion, the 2011 Germany E. coli outbreak really shows how careless handling and poor traceability in the food system can create massive public health disasters. It's clear that the authorities dragged their feet, waiting too long to communicate with the public because they were uncertain about the source. People shouldn't have to wait while they figured it out. So, compared to the U.S. peanut butter case, Germany's response felt reactive and weak, relying mostly on warnings instead of fixing the system to prevent future outbreaks. Both cases proved that communication and leadership are absolutely critical, but Germany really missed the opportunity to show proactive crisis management. However, if they had stronger monitoring and traceability systems in place, a lot of panic and illness could have been avoided. In the end, prevention requires upgraded equipment, environmental monitoring, dedicating food safety leadership. Also, transparent, science-based communication builds trust, public trust, and minimizes economic impact, and integrating technical safeguards with training and crisis management reduces the risk of recurrence. Thank you.